Okay. Hello, everyone, and welcome to our monthly webinar. I'm Michelle Meckelberg. I'm one of the board members of CASCMA, so the Canadian Animal Shelter and Community Medicine Association, and happy to welcome our presenter today, Dr. Scott Weiss, to speak on an exciting new topic, which we've all been hearing the buzz about, which is drug access for treatment of FIP in Canada. And so I'll give a very short intro for Dr. Weiss and lay down some ground rules, and then we'll get right into it. So if we're hoping to have this sort of an interactive question and answer based predominantly. So Dr. Weiss has prepared a few slides and then is happy to answer questions. And so you're welcome to put the questions in the chat, and I will keep an eye on things, and Dr. Weiss will as well, and we'll try to get through them as best we can within the hour. And certainly, if you can, as usual, put yourself on mute and all the kind things that you do for your colleagues to be able to enjoy this experience as well. So I'll give a brief introduction and then hand it over. So many of us know Dr. Scott Weiss. So he's a veterinary internal medicine specialist and the chief of infection control at the University of Guelph. We've also probably all relied on and appreciated his wonderful resource in the Worms and Germs blog. So I will pass over the floor to Dr. Weiss, and we'll keep an eye on any questions that come through. Thanks so much, everyone.
Great, thanks. Thanks a lot. I'm just gonna pull some slides here. So great. Yes. Okay, so I'll try to keep an eye on the chat. So if you have questions, feel free to toss them in. If I see anything that really hits with what I'm talking about, I'll probably back up and cover it. But we'll have lots of time for Q&A at the end. What I want to do is just give a fairly brief overview of the issues here, and then going to handle whatever questions you have. So obviously, we're here because of the changes that we've had very recently in access to drugs to treat FIP. And, you know, in medicine, we don't see many things that are really kind of revolutionary, but this is one. The drugs that we have that can treat this disease, which is basically invariably fatal otherwise, really has revolutionized management of these cats. So getting access to these drugs has been a game changer. Now, it's pretty straightforward, but I'm going to go through kind of where we stand with the different antivirals that we have potentially for FIP and why we've landed on a couple that we have access to in Canada right now. So if we look at a few different products, when we're looking at how we use drugs in animals, we can do it a few different ways. You can use licensed drugs that are available and produced and marketed for animals. So it's the stuff that we normally buy that's licensed for use in cats. We can buy it in Canada, we can use it in cats. That's the simplest. They're approved for that use. It's easy to get. We have compounded drugs we can get through normal channels in Canada. And we can also bring in drugs from different ways. So if we have a human drug, we can use any human drug in an animal. If it's in the country, we just have to use the drug. There's not a loophole to go through, any step to go through. If it's outside of the country, this is where the challenges come in. So if we look at the drugs that we have that could potentially treat FIP, the first one we've known about is remdesivir that you've run across through FIP, presumably, and through COVID. This drug actually is a much better FIP drug than a COVID drug. And the work on that goes back pre-COVID, where it was shown that this really did have a big impact. But access to the drug was largely shut down for various reasons. And now that it's been produced for people, there's been a resurgence in interest in it. This is available in Canada as a human product. So if we could get it, we could legally use it in cats. The challenge is we can't get it because what's available in the country is here on government procurement. So the government owns it and pharmacies can't sell it. And it's only in specialized pharmacies. So there's no access for us in Canada to the human Veklury product, which is the remdesivir product. Now, other things that we have in Canada, the other one is Paxlovid. So Paxlovid, you probably know, is an oral drug. It's used for early COVID in high-risk populations. And we have no idea what it would do in animals. It would probably do something for FIP. It's a coronavirus drug. The coronavirus drugs that work in people seem to probably work better in animals. We just know nothing about it. We don't know anything about the safety. We don't know anything about the dosing. And the little bit we know about the pharmacokinetics of Paxlovid in dogs and cats is it's probably different than in people. So this was kind of my plan D if things fell apart with everything else. But it's a drug we really don't want to use unless we had to because we just know nothing about it. Now we have GS-441524. That's a related drug to remdesivir. Essentially, what happens in the body is remdesivir gets converted to GS. So GS is the active form. So they do the same thing. It's just how we get them into the animal. There's also a drug called molnupiravir. So molnupiravir is another drug that's available for people. It's not available in Canada. It's available for people in some countries for COVID. It's used in cats in some areas. Australia, where it's used in humans, it's easy to access. It's oral. It's available at community pharmacies. It's used a lot more. General impression is it's not as effective as remdesivir or GS, but it's an option. But in Canada, we don't have access to it because we don't have a human product that's available. And then the one other drug you might run across is EIDD 1931. This is a related drug to molnupiravir, kind of like the GS remdesivir relationship. So we've got a wide range of drugs that we could potentially use, but we're limited in access to them because even though we have some of these products available commercially for humans in other countries, we have to be able to get them into the country legally. And that's why the black market is opened up, because people were realizing these drugs will be effective in cats. They work in cats. There's no legal mechanism. So what the hell, make some drug and sell it. So there's obviously widespread importation of these black market drugs. And the focus really is on remdesivir and GS-441524. That's both on the black market side and on the legal access side. So on the legal access side, the challenges that we've had are getting the drugs that are available in some countries. So there are compounding pharmacies in a few countries that are making legal versions of GS and remdesivir. Bova is the one in the UK that we're dealing with. They also have pharmacies in Australia and South Africa. So they're compounding the drug. So they're making a legal pharmaceutical formulation that's available like any other drug within those countries. Now, the challenge we've had about getting those in is the rules for importation into Canada really aren't set up for importing compounded drugs. Now, we can bring in drugs, and I'll explain this a little bit later, through an emergency drug release. And that's where we say, I need this drug for this animal. We don't have access to it in Canada. It's available in this other country, so can I bring it in? And that's what we do for various drugs we don't have in Canada, but we know can be useful. But those are set up around kind of typical licensed pharmaceutical products coming from companies. They're not set up for compounded drugs. And that's why it took a long time to get approval from Health Canada to bring these in. But now we do have permission to apply for an emergency drug release to bring these products in from the UK. I'll go over that a little bit more. So that's why we're focusing on remdesivir and GS, because we can get legal versions of them. And you may ask, why are we focusing on this if people can get access to black market drugs very easily? Well, I think there are quite a few reasons why we want to get into the legal channels. A is we just don't want to support a black market. We want to get things in through legal mechanisms. There are a lot of liability questions we know little about when we're using a black market product. There are safety issues because you don't necessarily know what's in there. They tend to work, but studies that have looked at the drugs in these black market products have shown they can be all over the place. A lot more drug than you think, sometimes less drug than you think, sometimes a different drug than you think, versus the compounded pharmaceutical products where they're made with very strict quality control rules. The amount of drug is going to be there. It's plus or minus 5%, just like any other pharmaceutical product. So our goal is to bring in these quality control legal products. So we got access now to remdesivir and GS-441524. Remdesivir is an injectable drug. GS, you can get injectable and oral versions, and we're focusing on the oral version. Now, we know that both of these drugs work, and this is from various studies and just observational use from where they're used quite extensively in cats. The take home from all of this is injectable remdesivir is no better than oral GS. I think that's a really important thing because injectable remdesivir is more expensive. It's a pain to use. It's very tough on some of the cats from injection sites. The pH of injectable remdesivir is about 1.3. That's really acidic. That's really irritating. And a significant percentage of cats treated with injectable remdesivir will get really nasty sores, lesions, granulomas at the injection site, as you'd suspect if you're getting 84 days of injection of something that's really, really acidic. So for both these drugs, we know they work really well. General take home is about 85% survival rate. Realistically, if a cat survives the first few days of treatment, their odds of survival are very, very high. Most of the deaths that occur in the studies where they've looked at this occur within the first few days. So these are cats that just didn't get a chance for the drug to do anything. They were too sick by the time the drug started. So if we can get them started in time, which is a really key component, prognosis is very good. It's a long treatment course. It gets expensive, but if they can get it through the first few days, their prognosis is really good. Okay, so I'm gonna walk through the emergency drug release process a little bit. So if you're a vet, this is directly relevant. If you're not a vet, this is what your vet's going to have to do, and this is how you have to work with your vet. And this explains some of the delays or some of the extra steps that might have to be done. So like I said, we have this process called an emergency drug release. And with this, what we do is we apply to Health Canada, the Veterinary Drug Directorate, and request that drug. It's done on an individual patient level. We can't say, I want to buy a case of GSM so I can use on the next 30 cats. We have to do it on a per animal basis because it's meant for emergency situations. And so what we do is we say, I've got a cat that I need to treat. There's the cat. Or you say, I've got a cat that I suspect is going to be treated. So you don't have to have that cat in front of you. A clinic can have a treatment course of this drug on hand on the assumption they're going to see a cat with FIP. So this has to be done by vets. You can't do this as an owner, as a shelter, or anything else. It's coordinated through the vets. The vets do the request. The vets have to do the follow-up on this. But once they get the drug in, it can be dispensed to you to continue to give it on that individual animal. For any vets that are here that haven't seen this, I've got a bunch of guidance documents we've made up. The Dropbox link, I'll see if I can copy it. Someone maybe you can copy and put it in the chat, or you can just email me and I can give you access to this. This goes over the process, has some sample forms, has supporting documents. So we're trying to make this as plug and play as possible. The EDR process is actually very straightforward. It's a very simple form. What's your clinic? Why do you need the drug? What do you need? It's really all there is to it. We have supporting information that explains why we want to use these drugs in FIP. And the Veterinary Drug Directorate is seeing a lot of these now. So, I think they're very much up to speed on why we want to do this. But if you are doing an emergency drug release and you don't have access to this, just send me an email and I can give you access to that Dropbox. So just the general process, again, if you're a vet, this is what you do. If you're working with vets, this is what they'll be doing with you. So when we're bringing in a drug, it's not licensed for use in Canada, we're shifting some of that liability to the vets. So it's up to the vet to be able to justify why this is being done because we're not using a licensed option in Canada because we don't have one. So vets are expected to explain that, the status of the drug, it's not approved for use in Canada. Possible risks and possible benefits, standard things we would do. They submit the emergency drug release paperwork. That's usually turned around pretty quickly. If the form is done right, the response from them will usually come back in a day or so. So what we do is fill in the form, send it to Health Canada, they'll approve it, and they send a copy of that to you and to the company because you put that information on there as well. That tells the company they're allowed to sell the drug to the vet, and then you buy it from the company and they ship it in. Total time, week, plus or minus a couple days. If the form is done right, it's turned around quickly and there aren't shipping delays, it could be less than a week, but there is obviously a delay because there are a couple steps and the drug has to be shipped in from the UK. So this is a bit of a challenge when we're treating a case and we don't have drug on hand. So we have to understand that delay component. So I won't go through the form just to show you what it is. You haven't seen it. Like I said, it's very straightforward. You're doing this at the veterinarian level at a clinic. So we've got the vet and then we've got the manufacturer information. If you're filling these out, like I said, in the Dropbox, I have some completed examples to show you what we need, but it's straightforward. Just what drug do you need? Where are we getting it from? Explain why we're going to use it. And this arrow I have at the top is really important. So again, if you're a clinic, if you're a shelter that sees a reasonable number of cats with FIP, or you expect to see a cat with FIP in the short term, and you're able to treat them from a cost standpoint, this is worth talking to your vet about. So like I said before, this is set up at the individual animal level, but we can order some drug in on spec. So essentially we're saying to Health Canada is, I'm going to be treating a cat with FIP sometime in the near future. I'm guessing it's going to be, probably no bigger than 4 kilograms, probably less than a year of age. So I'm going to get a treatment course in that would be appropriate for that cat. And so we have that on hand. When the cat comes in, we start treating it right away. And at the end of the process, when it's done, we tell Health Canada who that was. So we have to file a form at the end. So this is really important. If you're seeing cats and you want to treat cats, talk to your clinic about having some available. There's a cost outlay, obviously, because they've got to buy the drug and it's got to sit there. So whether they buy in a full treatment course or whether you can convince them to buy in 2 weeks, whether you guarantee you're going to pay for it if it expires. But even if you buy in 2 weeks of drug, You can buy in a part treatment course now and then get an emergency drug release for the rest of that later on, because we'd really like to be treating these cats as quick as possible. Clinics that are dealing with a reasonable number of FIP cases are going to, I think, start having drug on hand. That's what we do at OBC. We've treated quite a few cases now. So we're always trying to have drug available so we can start right away. There is a fee to this. So if we're doing it, you only bring in, a couple weeks worth and you need to do another EDR to get the rest, it does add in more cost. Currently the fee is $57. So it's not that big a deal in the grand scheme of things, but it is one extra cost and one extra kind of paperwork step that has to be done. And then, excuse me, then at the end of the process, we have to just kind of round everything out and tell Health Canada, here's the animal we treated it on, if they don't know that already, because we just got it on spec. And here's what happened with any complications. It's a very short form, but it just completes the whole process. And that's an important thing that we get done. Okay, so back to the drug. So Bova is the company I mentioned before. This is who we're buying it in from in the UK. They're producing this there. It's being really widely used in the UK and Australia and South Africa. And we can get a couple different drugs there. We can get GS or we can get remdesivir. And you can order both. Remdesivir, like I said, is injectable. The only situation we really want to use remdesivir is when the cat can't tolerate an oral drug. So if the cat's really debilitated, has really severe GI disease or gut stasis, and we don't think it's going to absorb an oral drug, we want to give remdesivir at the start. And because they tend to respond very quickly to either drug, we can start with a short course of remdesivir. So you got a cat that's really sick, it's got GI disease, it's maybe not going to absorb the drug very well. Okay, we can start on injectable remdesivir for a few days, or basically one vial, get a vial and use the vial, and then transition to oral GS on the assumption they'll be able to tolerate at that point. Because we really want to be using oral GS over remdesivir because there are much fewer side effects. We don't have to worry about those injection site problems that come up. It's quite a bit cheaper. It's about a sixth or a seventh the cost of the IV drug or the injectable drug. It's easier to administer overall. Some cats are difficult, but we're looking at an oral drug versus an injectable drug, and it's at least as effective as compared to remdesivir. So if we have a cat that is stable enough that it can absorb an oral med, go right on oral GS. It's going to be cheaper, easier. It's only one EDR. There are a whole range of reasons that that's better. This is a snap from Bova, the company that sells it as part of their kind of product list, just to give you an idea what's available. So we've got tablets. There is an oral suspension. We've not brought it in ourselves. Main reason is the shelf life is only 4 months versus the tablets are 18 months. So when you're looking at a treatment of 84 days, we don't want to have drugs sitting around that's going to expire maybe not too long after we get it in. So this is a situation where I don't think many clinics will be bringing in oral suspension, but we'll transition as needed. So if we start treating a cat with oral tablets and that's not going very well and they want to transition to a suspension, then we would order the suspension in. Again, it's an extra step. There's an extra $57 for the EDR, but for some cats that might be necessary. So it's good to know there's an oral suspension, but because of the shorter shelf life on it, it's probably not we're going to see many clinics stocking. Just in terms of cost, everyone asks about cost. Obviously depends on the cat size and depends on the dosing regimen, because those vary a little bit, and I'll go over those in a few minutes. Realistically, if you're looking at a smallish, like a typical FIP cat, we're probably looking at about $1,800 to $3,000 drug cost. So if you're wheeling at the clinic, there'll be a markup on that. Usually it's not substantial. There's the cost for the EDR, the $57. Shipping is about $90. Take home from that is it's really not any more expensive, and it's potentially cheaper than the black market versions, especially when people are just getting injectable black market drugs, which can cost $10,000 to $13,000. So switching to the legal option does not bring in any substantial cost increase or necessarily any increase at all, especially when you can get right on to oral GS. Okay, so I'm going to go over just some treatment recommendations. A lot of what we're basing this on is from the UK, where they've done a lot of work on this, including looking at drug levels and different dosing regimens. And this is from the UK's FIP advice team. So I'm going to go over a couple of their more recent recommendations. These are some changes we just did a few weeks ago. So if we're using a remdesivir, it's a once-a-day drug. You don't want to inject this thing any more than we have to. We use higher doses for ocular involvement and even higher doses for a neurologic FIP. And that's been pretty standard dosing for a while. The changes that have happened in the last few weeks or month or so has been bringing in twice-a-day dosing as an option or a recommendation. And it's based on the understanding that, yeah, most cats respond really well to once a day dosing. But some of the cats that don't respond, that might be because they metabolize the drug a lot quicker and the levels are dropping, and twice a day dosing might be better. Is it better to go on once a day or twice a day at the start? It's hard to say. We just don't have good comparison information. If the cat's treatable and a little bit extra cost isn't a deal breaker, I would go on twice a day dosing. The total cost ends up being a little bit more. Like we're using it twice a day, but we're scaling the doses back a little bit. So if we're going for normal wet FIP, we'd be 10 milligrams per kilogram once a day, or 6 to 7.5, so 12 to 15 milligrams per kilogram per day if we go twice a day. So you're looking at a 20 to 50% increase in cost. So obviously that might play a role. And you might default to one, if cost is an issue, you might default to once a day dosing. And if things aren't going very well, then we go to either a higher dose or to twice daily dosing. In the perfect world, we'd probably go with twice daily dosing on every cat. Adverse effects. So I've mentioned this already with injectable remdesivir. It's really irritating. It's really acidic. Pain is very common. Abscessation, these granulomas, these ulcers. Some cats handle it very well, but it's really not uncommon to have significant adverse injection site issues. We can see some increases in liver enzymes. Not that big of a deal. Any drug, you can see a drug reaction of some sort. But the main issue is really the injection site abscesses. Oral GS, it's remarkably safe. There at least seems to be. There are very few adverse effects. Pruritus, so itchiness, it's mainly reported with the black market drugs. And I'm not sure if that's just some reporting bias or whether there's something in some of these products. This doesn't seem to be a major issue or a deal breaker or something we would stop treatment about. It's something that we manage often just with antihistamines or anti-inflammatories. So overall, these two drugs seem to be very safe. And I see it as a question there. How is treatment response measured? There are a few different ways. The main one really is the clinical response. And these cats tend to look good clinically, or look better clinically within a few days. And that's the first key indicator. If they aren't responding at all clinically within a few days, the prognosis is going to be very poor. And it would also suggest that FIP isn't the cause if you haven't really definitively identified it. Because response to treatment actually is a fairly good diagnostic test. Now, a dry FIP case, especially, we're not really sure what's going on. Start them on GS. They perk up in a couple of days. There aren't that many other things. Well, there's really nothing that should respond to GS besides FIP. So initially, we're looking for clinical response, and they'll get a little more into monitoring as we go through. Actually, we're right now, I guess. So monitoring. So we expect to see clinical response within a day or two. So we want to see them, brighter, better appetite, just overall systemic status. They look better. We start to see the effusions decreasing. We start to see them putting on weight. So you should see a cat that's noticeably happier within a couple of days, and then we see the gradual increase. They're not going to go absolutely normal and shrink down the infusions in a day. We want to see them moving in that direction. We really want these cats to be weighed regularly. Weighing is good just to monitor the response to treatment, but it's also important because these are often young, scrawny cats who are going to put on weight during the treatment, and we want to make sure we don't underdose them. So we have to keep reassessing their dose as they gain weight, because we're looking at 84 days and a young cat that was sick and now is doing well. There are some cats that will need an increase in their dose, the number of tablets or partial tablets they get to keep up with their weight gain. And here's where we bring in some other things that we'll monitor. So some of the hematologic parameters, their globulins, their antibody level, their protein levels. Really, how much we monitor that depends on how abnormal things were at the start, for one thing, how easy it is to access the cat, and cost, because there's some expense there. And this isn't really a make or break thing, because as long as they're responding clinically, we're going to keep going. If they had, significant signs of liver disease or kidney disease or something else we're worried about, we want to monitor them more closely. So this is kind of made up based on how the cat looks and the overall situation and practicality and cost components. And then we want to have a really good exam before we stop. And we want to make sure that we're convinced that they've responded. 84 days is the long treatment course. Probably we're going to end up being shorter treatment options down the road. I suspect that most cats don't need 84 days. We just don't know at this point. But we want to be quite comfortable they've responded to treatment. So ideally, we're going to get a good assessment clinically. We're going to find that their blood results are all back to normal a week or two before we stop. Because if we're still seeing something that's a little bit concerning, we might want to extend the treatment period, or at least we might want to monitor them very closely. In general, though, they're going to be back to normal if they've made it that far. Now, like I said, 80-some% we expect to respond. The ones that don't respond, we usually see that very early, they die in the first couple of days. Now, there are always exceptions, and some cats just won't respond as well. They'll respond a bit, but not as much as you'd like, or they'll respond a little bit, and then they'll deteriorate. So what we would typically look at here is check the dose, make sure we're giving the right dose. Math errors happen, translation problems happen. People misinterpret what we tell them to do. Cats grow. Cats get difficult to pill, and the owner doesn't really make sure, or the worker doesn't really make sure that pill stayed in the cat's mouth. So the first thing I would do is check dosing and compliance, because those are our two really good examples of what could be going wrong. We can consider dose increase. We can consider going to twice a day as the two main things if we're not getting as good a response as we would suspect, and we're convinced it's fit. The other thing is if they're not responding well, like I said before, they want to back up and make sure that we're really convinced this is FIP and there's not something else. Ultimately, what we want to do is be able to measure drug levels. And it's not something we're set up to be able to do right now. But maybe in the future, we've got a cat that's not responding very well. We get a blood sample. We see what the GS levels are to see if they're high enough. If for some reason this cat's burning through the drug a lot quicker. So that's something that potentially down the road. But realistically, at this point, we're going to look at the dosing, look at the cat's weight, really go over, are we getting what we think we're getting into the cat? Are we convinced it's FIP? And if it's yes to all those, let's bump the dose, or let's go to twice a day. Now, a couple of things come up in treatment of these, like what else do we do? And it depends on what else is going on with the cat. If they've got other health issues, we deal with those other health issues. So these are just some general points. So steroids like prednisone, we tend to avoid them in general. Like I'm certainly not worried about using steroids in infectious diseases. We don't use massive doses and immunosuppress them. But steroids can be associated with complications, so we just don't want to use them unnecessarily. General recommendation is don't use steroids unless you really have to, and that's mainly going to be when there's ocular involvement or when there's severe neurologic disease. So I was talking to someone the other day of a neurofip, started on treatment, responding okay, but not great. Dosing was good, was on twice a day dosing, so we got them to start prednisone. I haven't heard what's happened with that, but that would be a situation where I'd be quite happy to go with pred at the start. If you've got neurodisease or ocular disease, short courses, reasonable doses, bring down that inflammation while the drug is starting to have its effect, and then the drug take over from there. Other things that come up, there are various other drugs that have been mentioned or tried in different areas to modify the immune system. Take home is we don't have any evidence that they work. And just because GS works so well, there's not really a lot of impetus to use something that we've got very little evidence that does anything, and potentially some harm components of it. So we're fairly straightforward, not adding on a lot of other drugs like interferon, mefloquine, and things like that. What do we do with these cats while they're being treated? So FIP is really associated with stress, right? That's one of the factors that makes FIP develop. And it certainly doesn't help when you've got a sick animal. The more stressed they are, the harder it is going to be for them just to respond in general to any disease. So we want to limit stress, but we don't want to take that to the extreme that we deprive them of proper health care. So for spay, neuter, generally we don't want to do it during treatment. We'd rather have them stable, get treatment done, get them a little bit after their treatment, so we have a really good post-treatment baseline, and then spay them. But we can't always wait that long. So there may be reasons that the animal has to be spayed or neutered. If there's a household dynamic issue, there's a behavioral issue, if there's a health issue where spaying or neutering just needs to be done, say go ahead and do it. The risk is probably really, really low if the animal is clinically normal. You're not going to have a cat that's got FIP and we're 5 days into treatment, he's starting to get better, but this cat's still sick. We're obviously not going to want to spay or neuter it then. But later in the treatment course, when this cat's looking clinically basically normal, if you have to do surgery on them, we would do it. We would prefer not to. Vaccination, same thing. I would rather vaccinate them than not vaccinate them in general, especially a young cat that hasn't had a vaccine at greater than 16 weeks of age. So we really want to get at least one core vaccine into all cats at 16 weeks of age or greater, because that's the age we have confidence they're going to respond to that vaccine. So if we've got a cat that hasn't had that, I want to get it clinically stable, and then I want to vaccinate it as soon as I can. I don't want to wait until after the treatment course. Yeah, vaccination is a stressor, but there's not really anything that would suggest that vaccination is going to increase the risk of a flare, that they're not going to respond very well to vaccine or any other outcome. So I rarely pass up an opportunity to vaccinate if I think it's required. So other things, well, we just don't really know. And that's one of the problems with the disease that's been treated largely underground. We've got kind of lots of kind of weak low-level data. We don't have really good organized data, and that's coming together now that treatment's being, done in more areas in a more organized manner. So like I said before, with no evidence we have to change our overall healthcare approaches. We just want to do them to healthy animals as much as we can. Limiting stress is always a good thing. We can only do so much with that. Now, I've just got some common questions and keep putting questions in the chat if you have any. I'll just get some of the ones that come up a lot. So one thing that often gets asked is, do I need permission from province to do this? And the answer is no to that. So by getting the emergency drug release from Health Canada, that's permission to bring the drug in, right? You've got a federal agency that says, yes, you can import that drug. It's a legal mechanism. That's the permission that we need. I'd probably cover this one. When should I start with remdesivir over GS, the injectable drug? And that's basically if we have concern the cat can't absorb an oral drug. If we're confident it can absorb an oral drug, go right to GS. Cheaper, easier, better, a lot of different things. Do you need specific testing to get an emergency drug release? And the answer to that is no. You need a reasonable suspicion the cat has FIP. So you just need to say to the point where I think treatment of this cat makes sense. So you don't have to say what tests you did. You don't have to have a PCR result. You can have a pure clinical suspicion on this cat and start treating, because that's an appropriate use, right? We're treating based on our diagnosis, and this can be a clinical diagnosis. And maybe that leads into a question I see there in the chat. The condition is notoriously difficult to diagnose. A treatment trial would be helpful. Actually, basically, that's the exact same question. So yes, if you have drug in, I think that's an appropriate use, because you're making a clinical, if you're going ahead and treating, you're making a clinical decision that there's a reasonable chance this cat has FIP. And you've got the back of your mind, maybe it doesn't. So I'm going to see how it responds, but I still think that's a legal use. And no one has said there's really a concern with that. And Health Canada knows there'll be some situations we won't make it through the full treatment course. I'll get to that in a sec. So, and the second part of the question I'll cover in a minute there, what happens to the drug. So I think as long as we have enough reasonable clinical suspicion that they have FIP and we think it's warranted to treat, we can treat. That fits the requirement. There is no baseline. You have to have this type of diagnosis to use the drugs. And maybe I'll just cover the second part now. What happens if you don't? You do a treatment course and you make another diagnosis partway through, or the cat dies on day 4, and now we've got 80 days worth of drug here. As long as that drug is still under your control, you can use it for a different patient. So what we don't want to do is have a vet clinic get 84 days and send it home with a really sick cat, because once that's gone from the clinic, we can't be bringing it back and reusing it because we don't know that that's actually the drug, right? If we've kept it in our clinic and we've dispensed 7 days and the cat dies after day 4, well, we've got the rest of that treatment course. Health Canada said we can use that drug. We just have to report that ultimately. So we have to, that form we have to fill out at the end, we would just have to account for that. So, if you've got a partial treatment course and then you have to do an emergency drug release to get the last 10 days, your emergency drug release would just say that I need another 10 days of GS because I started with a treatment course that was left over from another animal. So we don't have to throw the drug out. And this is why I think it's useful to have a full treatment course in the clinic, because you're not committing yourself or you're not committing the shelter or the owner to the full cost as long as we dispense it properly. So the shelter, if you work at your vet, you might say, okay, well, we know we're going to spend $3,000 on FIP drugs, but that might get distributed over a couple of patients if they don't survive, if that makes sense. And if some of the stuff doesn't make sense, jump in, but that's not a barrier. Either not having a diagnosis or being concerned that you have to throw the drug out. Neither of those should be a barrier. The cat that's being treated with black market drugs, can we now get an EDR? There's no barrier to that either. And they're really, from common sense standpoint, we're transitioning to a legal option, safer option, so it makes sense. And you wouldn't have to say that in the emergency drug release. I think you just say that we need, how you word it probably doesn't really matter. But you would just explain, we only need 40 drugs because the animal's impartially treated. That's probably all you would say. And I don't think they would raise a concern with that. So you can still get an EDR and you can still switch to a legal drug. And I would definitely recommend that. And we are going to see, while we are seeing hybrid approaches where you've got a cat with FIP, the clinic doesn't have any drug uh, in stock right now. They're going to order it. They know it's going to take a week. We are seeing situations where the owners will go and find a week or two of drugs. Because you can find it in a lot of cities, you can get it within a day or so. So get the black market stuff started off there, then transition to the legal option. As vets, we can't say, go order a week of black market drug and then we'll switch to the good stuff because we can't be counseling someone to do something that's illegal. But we can certainly, you can look up something. If you can find something, go for it. Your illegal drug's going to be here in a week. So having a cat that started on black market drug isn't a barrier to this at all. One question that comes up quite a bit is, can we move drug around? So if you're in one clinic or one shelter and you want to get drug in, can you borrow it from another clinic? Because we can do that with regular drugs in vet clinics. You can share them across clinics. You can't do that with these drugs because they're brought in at the veterinarian and that individual animal level. So if we have one clinic that has drug and the clinic down the road doesn't have drug, there's a cat they want to treat, the only option is to start treating that cat in the first clinic, and then the other clinic can order the drug in. So if clinics get along, that's fine. And that's why we're seeing some people looking into referral because they can get treated here or get started treated here quicker than they can. So another advantage, again, of having drug ordered and on hand. If you're in a shelter, though, you're dealing with multiple clinics. If you have one clinic that will keep the drug on hand, then obviously that's the most logistically feasible way to do it. Can I change the treatment plan after I get the EDR? So you said, okay, I'm going to go 10 mg per kg once a day, and then the cat's not responding very well. Can we go to twice a day? And that's fine. We just submit supporting documentation that explains why we want to use this drug, and we just put a contingency in there. We're planning on 10 mg per kg once a day, but in some situations we might have to change that, and here's what we would do. And again, we just have to report at the end. So there's a lot of flexibility in what we do because that's how we treat patients. We covered the leftover drug question. Can order a partial? I guess I kind of covered this one, but again, just to come back to that. So, you're looking at a couple $1,000s to get drug in. If you're not sure you're going to treat a patient, can you get in either as a shelter? Can you have a clinic, have some on hand that you guarantee you'll use? Or as a clinic, can you have some on hand? Yeah, you can order 2 weeks, 3 weeks, whatever. It's cheaper. Order the rest once you start treating the cat. It just means you have the second EDR, the second shipping cost. So it does bring up the cost a little bit and the hassle a little bit for a drug that's got a shelf life of over a year. But if you really don't think you're going to see many patients with FIP, but you really want to have some drug in, that's an option. I mentioned the GS suspension. Yeah, it absolutely can use it. It's not something I would order in advance, but if we have a patient that we think we're ordering a drug in for now, and an oral suspension is the best version, it's a little bit more expensive, but it's not prohibitively expensive. And how long to take the drug in? I think I covered that. It's about a week. We've had some clinics say it's taken a couple of weeks. I think most often that's when there's a problem with the paperwork when it's the first time. Most places it does seem to be around a week. Now it's going to depend on where it falls on the weekend and time of day things get done. So there's always a plus or minus a couple of days. But I would expect a week or so if you're ordering the drug. I think that was all the list of my common questions. Yeah, so again, keep tossing stuff in the chat if you see some. Is there a measurable point in the course of treatment where it's unlikely to be effective? Is it too late? There's not a hard stop point. The sicker they are, yeah, the worse the prognosis. If they've got neurologic disease, the worse the prognosis. If they've got neurologic disease and they're seizuring and they're poorly responsive, prognosis would be really poor. It doesn't mean you shouldn't try it. It's part of the thought process would this cat survive 24 or 48 hours without treatment? And if you say, well, maybe, then treatment certainly makes sense because even if it takes a day or two to ramp up, like that's the window we're talking about. If you're looking at this cat saying it's probably going to die overnight, then your treatment's probably not going to do anything because you're not going to have a chance to do it. But there isn't really something we can say, if this value is X, don't try treating because it's not going to work. Ultimately, we may get there and it might be with the severity of the neurologic disease, but I don't think we have the ability to do that. Is there a better diagnostic test? Well, like Linda said, it's a pain to diagnose. Like sometimes it's really bang on. Sometimes it's tough. A young cat with ill thrift and lots of fluid in its belly, and it's high protein fluid, and it's got high globulins in its blood work, that's screaming FIP. That's pretty easy. That's a diagnosis right there, really. If we do PCR and we find the virus in places it shouldn't be, like in fluids, that's diagnostic. Essentially what we're trying to do, and we didn't get into the whole how does FIP develop, but it's caused by feline coronavirus, a virus that lives in the gut of cats. It's very widespread. You have it in your shelter. If you get groups of cats together, you have coronavirus there. And it's just a normal kind of background virus. But what happens is it mutates. And it mutates just randomly within the cat to a form that can infect tissue. So when we're diagnosing it, we're looking for all the effects of this virus, but we're also looking for the virus in places where it wouldn't be if it was a normal gut virus. So if we detect it by PCR in a fluid, that shouldn't be the normal enteric virus because it shouldn't be in there. So that's our most commonly used diagnostic test clinically is going to be PCR from fluids or from tissues that are well away from the gut. There's no use testing feces because that's where that virus is supposed to be. And blood looking for antibodies is pretty useless too because a large percentage of cats have been exposed to just the normal coronavirus before. And being positive to antibodies doesn't tell us much. So it still can be a challenge. The dry FIP cases where there's not a lot or any evident effusion, those are the biggest diagnostic challenges probably. And that sometimes we get to the point where, you know, it's young, it's got these factors, it's got high globulins, FIP's number one on my list, then treatment is perfectly reasonable in mind. Let's see. Long-term outcomes for these cats. Are they cured, stay cured? Do they recruit us? Great question. Don't know, and don't know is really the answer to those. From what we know, like there have been a lot of cats treated with black market drug. So it's a bit hard to extrapolate because we don't know exactly what they got, but typically these cats do well and they do well long-term. Some will relapse, and relapses can happen at any point. I would say the incidence of relapse, if they get through the whole treatment period and they're looking clinically normal, hematologically normal, and everything in the treatment period, relapse rates are really low. Challenge, I think, for shelters is talking to adopters, say, we treat this cat for FIP, it's a perfectly normal, healthy cat. When they say, what are the odds the disease is going to come back? I don't think we can separate now. I think it's low. That's all I can say. We're going to know a lot more in the next 4 or 5 years as we start tracking these cats. But you know, it's you can't do long-term studies until you've had cats that have been treated long-term and monitored long-term, and that's the point we're at right now. But if we look at the black market cats, I don't think we see that many where, you know, they were treated a year ago and now they've got FIP again. I'm not sure I've seen one. So I would say that again, if they make it through the whole process and they look hematologically normal, clinically normal at the end, odds are very low they're going to have FIP. That's a bit of a guess, but I think it's probably a reasonably informed guess. Formal studies in Canada, nothing right now. We've been trying to figure out what to do and how. There's no money to do any of this, which is the biggest barrier. What we'd like to do is well, one of the things I want to do is look at what we just talked about, look at the long-term outcomes. And that's going to require cats that have been treated. So I think we do need to do some 1 to 5 year follow-ups on these. And that's something we've been looking into. We just haven't got any started up right now. So in terms of formal studies, looking at this, don't think we have any. We've got discussions on trying to do them, but we're not there yet. So if anyone wants to provide data, though, we'll probably be harassing in the near future about it. We have a lot of people bringing in drugs, so I think we're going to have a reasonable number of cats that are treated. So hopefully we'll be able to pick up some of that. Let's see if any other questions. I think that's all the questions, but keep tossing them in.
Yeah, we'll give another minute or so for questions, and then if there's no more questions, we'll wrap up.
I see Linda's question, it's in the answer one, but I guess I covered that, but it maybe not exactly at the shelter level. So if you brought in drug, can you transfer it to other shelters? That's the same thing as clinic to clinic transfer, that you're bringing in the drug for that individual veterinarian to use on that individual animal. So if you have a veterinarian in the shelter and that vet has a drug in there on spec, they could use that, but they have to have the relationship with that animal. So they could treat any animal in the shelter, but once they send it to another vet, then they're not the primary caregiver. They don't have that veterinary client-patient relationship. So that means the drug is now not being used as per the EDR. So what we want to do is move the animal, not move the drug, if that makes sense. For cats that have been treated successfully, do we handle them like normal cats? Yeah, like I think kind of what I was saying before is we try to limit stress as much as we can. We want them to be healthy, and ideally we wait until after the treatment period and probably a few weeks after the treatment period just to let us get a good baseline, let them get over it. So a dental, like if this cat's for some reason, if the cat's got a fracture and it's got something that's painful, do the dental. I don't care when it is, do the dental because the morbidity and the pain from that needs to be addressed. If it's got something elective, let's wait until a couple of months after the treatment's done. For the spay or neuter, like I said, the cat can be fine. Let's wait a couple of months. If that cat really needs to be spayed or neutered right now because there are significant issues, go ahead and do it. There's probably a slight risk, but probably not that high a risk. Same with vaccination, I don't have concerns about vaccination. If the cats responded well and they're healthy, vaccinate them. I'd rather vaccinate them than wait, right? We don't want to take a cat that's not been properly vaccinated, say we're going to wait till after the treatment course and it dies of panic. So don't pass up an opportunity to vaccinate. Indoor, outdoor, there's no risk there. We traditionally consider FIP to be non-transmissible. That's probably a bit of an overestimate, but the risk from a FIP cat of transmitting to another cat is exceptionally low to zero. Once they've been treated, it's basically zero. And once they've been treated and they're clinically normal, the risk of them picking up something is probably no greater than your average indoor outdoor cat. So I don't think we need to change that. We've seen an increase in FIP since COVID. While there can't be any relationship with it, it's a completely different virus. We've seen changes in a lot of disease patterns since COVID. And that largely relates to how we interact with animals, more animals, different interactions with them. I think our perception is, I think we've seen more FIP over the last maybe 5 or 10 years. It's definitely something we're talking more about. But I don't think there's any relationship with that. And there definitely can't be a relationship with SARS-CoV-2 because they're just completely different viruses. But yeah, we do see differences based on how we interact with animals. So the EDR info. So yeah, for the Dropbox, probably the easiest thing is I'll put my email in the chat here. So if any vets want to have access to the Dropbox, just send me an email and I'll send that back. That's probably the most efficient way to do it because you won't be able to copy the link. Yeah, Lynn is asking how many places see FIP. And it's one of these things, I think the background noise is always there. We do see clustering in shelters, which is one of the reasons I say, we've always assumed it's non-transmissible. I'm not completely sold on that. And there's a Cyprus incident that kind of relates to that. But yeah, we don't understand the epidemiology very well, but we know when they're young and they're stressed and they're in dense environments, some of these cats will get FIP when they go home because they're getting stressed and they're getting exposed to the virus in a shelter. And it's not because there's anything wrong with the shelter. It's when you bring a bunch of cats together, you're going to have circulating feline coronavirus. I'm just going to have to move the plug in the computer, I think. Do you expect the cat will mount a decent immune response to vaccination? So I think if they're healthy, yes. And that's why I say once they've responded clinically, I'm pretty comfortable with that. If they're still sick, then I'd rather not vaccinate them. But once they've responded clinically, there really shouldn't be a barrier to a good response to vaccination. Do coronaviruses do this in other species? Yeah, that's a great question. Not really. FIP's a weird disease, and we don't have a great analog in other species, which is one of the challenges we have in studying it, because we can't just look at human studies of FIP and say we're going to do the exact same thing they did. So, coronaviruses mutate. We know that. That's a well-established fact. We just don't see a FIP analog in other species. Moving a plug here. We get all the questions there?
Looks like that's the end of the questions.
Great.
Lovely.
So if like I say, if there are any questions, my email's there. Don't be afraid to email me. We're still trying to sort out a lot and we're still learning a lot. If you're vets and you're importing the drug, it's never a bad idea to check back into the Dropbox periodically because we do change the guidance as new things come. So I don't imagine we're going to have any big treatment changes since we've done the recent one, but you never know. So it never hurts to check in on that. If we have major changes, I'll probably be putting that up on my blog anyway. but it is still a fairly dynamic site. And just because we're now in an era, we're getting a lot of data from different areas because they are being able to use the drug. We're probably going to be changing some things more. What I would hope to do is see us going to shorter durations. And this would be, I think, particularly relevant for shelters because of the cost component. And there is some work being done right now looking at shorter durations of treatment. So, if we can cut it down to 42 days, you cut the cost in half, which is a pretty substantial advantage for shelters if you have multiple cats to treat.
One last question that came in. It looks like the question is after being treated, should they be kept away from healthy cats?
No, we're not worried about them, especially after treatment being transmissible. So the general line, like I said, is once they've got this FIP, so once the virus mutates to becoming a virus that causes FIP and it's in tissue, the assumption is that virus isn't being shed. So in general, we don't say even untreated FIP cats should be kept away from other cats. I don't think it's 100% certain that that's actually true, but the risk is exceptionally low. Once they've been treated, if there was any risk, it's probably gone very quickly because the virus should be controlled by the treatment. So don't really worry about that. And transfer from moms to kittens or transfer the virus, absolutely. Transfer of FIP isn't the concern. So if mom's shedding coronavirus, then the kittens could certainly be infected with the coronavirus, but that's just like a large percentage of kittens. And that's why this virus, we're never going to eliminate FIP because it's caused by a virus that's like, like a common cold. It's just circulating. It's everywhere. If you have 10 cats together in a group, you've probably got someone that's shedding coronavirus. So we're worried about controlling FIP, the disease. We're not trying to control the coronavirus because we're never going to be able to.
Sounds good. I'm seeing thank yous come in. Oh, and another one. So if we treat and it turns out not to be FIP, can we harm the cat by having started?
It shouldn't be. So that's one of the nice things about GS is it's really safe. Like we just don't see, never say never. There's always some risk with any drug of a strange drug reaction, but we're not worried about treatment trials because you're going to know fairly quickly the drug does seem to be fairly safe and we can stop if we don't have a reason to use it. So I'd want to have a reasonable suspicion of FIP, just that I wouldn't want to treat without it, but I wouldn't have any health concerns for using it.
Well, I'm going to call it here. And thank you very much, Dr. Weiss, on behalf of CASCMA and all the attendees, obviously for this information. But I mean, I'm sure you get told this all the time, but your presentation style is really easy to understand and makes complicated processes very, very digestible. So I appreciate that for sure.
Thanks
And
a
I
lot.
thank everyone for attending and hope everyone takes care. Thanks.
Bye. Have a good day, everyone.
Bye.